Hello, IVF Babble friends. I'm Dr. Jessica Garcia from Clinica Tambre. And today we're going to talk a little bit, about endometrium. We're going to talk about the newest analysis available for checking the endometrium and just overall to see when we're doing an IVF, an embryo transfer, what makes a good endometrium. So, to start, let's talk a little bit about the treatments in Spain. Why Spain when we're doing a fertility treatment? Well, first of all, here in Spain, we have a cutting edge technology. Also, when we are doing treatment with egg donation or sperm donation, we have the anonymity, which is something that in other countries, it doesn't exist. Also, we have a unique legislation when we talk about the treatments, fertility treatments, egg donation and everything. This legislation is very open-minded compared to other countries in Europe. So that's why many people select Spain to doing the treatment. And also here is one country where we have the possibility of doing treatment for patients up to 50 years old. So just a little bit about Tambre Fertility Clinic, where we are located close to the center of Madrid. We have more than 40 years of experience. Also, we have the latest technology in assisted reproduction. In the laboratory, we have all the newest technology and everything, and we are constantly changing all the technology and everything just to be. So also something really important is that we have our own sperm and egg bank here in the clinic. Also, we have the highest success rates. We always like to do personalized treatment for the patients because we know every one of the patients, each is unique and you need a personalized treatment. So also other thing, which is really important, is that we have qualified international team of fertility experts. And I will say the most important factor that we have, and it's different from other clinics, is that we have this human and warm approach. And we always try to do it in your own language. I think, that's basic when you're doing a treatment like this. I think it's super important in order to feel like more comfortable in everything. So now that we're facing this pandemic, we have a protocol regarding COVID-19. We have, first of all, we have individual waiting room. So you don't have to wait with other patients. You can be in your separated waiting room. So this is really, really important to feel safe and everything during the whole process. Also, we have regular testing for all the employees, donors, and also the patients. We have, once you arrive to the clinic, we have a temperature check. And also, once entering the clinic, it's mandatory to use hydroalcoholic gel and also face masks. Everyone has to wear masks and everything. So also we're trying to improve, we did an improvement in all the treatments and all the protocols in the process and everything to avoid unnecessary traveling. Because we know that with this situation that we're facing, it's really difficult to travel. And we don't want you to be at risk or something. So we are trying to make everything easier and more accessible. Now let's get into the topic that we're going to talk today. First, I'm going to explain just a little bit about the functions of the endometrium. Then I'm going to talk about the newest analysis that we can do to the endometrium. And then I will give you some final recommendations. So what's the endometrium? Well, the endometrium is the inner lining right here of the uterus. And also here in the endometrium is where the implantation of the embryo takes place. So every month the endometrium, under the influence of the hormones, is changing constantly. And first of all, the estrogen causes the endometrium to thicken, to get thicker. And then the progesterone matures the endometrium to complete the cycle. And in this way, is ready for the implantation. When we're doing a fertility treatment, the endometrium is super important, obviously. And well, there are different ways of preparing the endometrium for an embryo transfer. So when we do a fresh embryo transfer, usually is after the IVF cycle, when we do the whole treatment and then the embryo transfer in fresh. The other way to getting ready is to have frozen embryo transfer and using sometimes estradiol and progesterone to get ready, sometimes the natural cycle and letrozole and other therapies that we can use. There are different ways of getting ready, but basically most of them are based on getting the endometrium to get ready in different ways of functioning. How do we know during the treatment that the endometrium it's okay? So usually what we do, and the most common way to check the endometrium is to do in ultrasounds. So during the treatment, we will do a couple of ultrasounds just to make sure everything is perfect. Also some hormonal tests just to make sure everything is perfect. But talking about the endometrium, we know that when we do one ultrasound, when we are almost in the end of the treatment, we need to see the endometrial thickness. And for all the information that we have, it seems that it's better to have the endometrial thickness over 7 millimeters and also with a triple lining pattern, because we see that we achieve the high success rate when we have this. So what happens if we are unable to have this endometrial thickness or the triple lining pattern? Sometimes it's necessary to do treatments. There are lots of options, and for every patient will be a protocol different, but we could use aspirin, Viagra, letrozole, and so on to try to achieve that, endometrial thickness that is so important. Other thing which is, well, basic during the treatment is the endometrial receptivity and also the window of implantation. Usually, well, the window of implantation is defined as a period right here where the uterus and especially the endometrium is receptive for the implantation of the embryo. So this period of receptivity, well, is very short, usually just a couple of hours. And then it's the result of the estrogen first taking place here in the endometrium, and then the progesterone, the effect of the progesterone. The two of them together, especially the progesterone, is the one that opens the window of implantation. So recent studies show that every woman has a personal window of implantation. Usually we will say the majority of the patients have this implantation window open after 5 days with progesterone. But we see in the latest information that up to 30% of the patients have this implantation window displaced. They need less hours or more hours with progesterone. So it is important, that's why it's so important to check the implantation window before we do one treatment. So there is now one test which is called the ERA test, which checks the endometrial receptivity. So it seems that this test ERA might increase the chances of getting pregnant during the embryo transfer by predicting the ideal time for the implantation of the embryo. So when we decide to do this kind of analysis, we need to do the whole treatment, like we already talked, exactly like we were going to do an embryo transfer. So we get ready with the estradiol, the progesterone and everything, but instead of doing the embryo transfer, we will take a small sample of this tissue, the endometrial tissue inside of the uterus, and we will do the analysis of this tissue. And this analysis is done under 248 genes, and it is why we can know if the endometrium is receptive or if it needs more or less time with the progesterone, pre-receptive or post-receptive. So what happens when we have the result and the endometrium is not receptive? Sometimes it's necessary to do, well, a personalization of the embryo transfer protocol. Also, sometimes it's necessary, well, just a few times, it's necessary to do another biopsy just to make sure where we are exactly in the implantation window. Other thing which is really important and it's taking attention lately is the endometrial microbiome and the chronic endometritis. So what we know for the recent information is that the endometrium, when it's normal and it's healthy, it has present a lot of normal bacteria, mainly lactobacillus, and this is normal. We have lots of bacteria there, but the normal bacteria. Sometimes we can have harmful bacteria inside of the endometrium that can cause chronic endometritis. So what happens when we have one of these abnormal? So most patients will be asymptomatic, won't have any symptom, and you cannot realize that you have any of these by the scans or anything. There is no way of knowing unless we do this analysis. So this analysis is called the EMA test and the ALICE test, and usually we do the two of them together. Sometimes we have the option of doing these two analyses also with the ERA test, so the three of them together. So every patient is different, and depending on the case, we will recommend to do one or two or the three of them. This EMA test checks the endometrial flora, and it lets us know if we have the normal bacteria inside of the endometrium or if it's abnormal. The ALICE test identifies if we have some harmful bacteria inside, maybe the most commonly associated with chronic endometritis bacteria. And if we have, once we have these results, and if we have abnormal results, we will know also by the test if it's necessary to take some probiotic or some antibiotic treatment, and which one for each patient. Sometimes it's necessary to do a second biopsy, which is included already. So this will be the information. Something really important, my recommendation, is to always pay attention to the endometrium, because the endometrium, just as the quality of the embryo, are the most important factors for a successful treatment. So sometimes, well, personalized treatment for each patient, obviously, and well, depending on the medical history and everything, maybe doing more analysis to the endometrium just to make sure everything is fine before doing the embryo transfer. And well, we have now some tests that are new, such as the ERA test, that now with all the information that we have, it seems that this test improves the pregnancy rates after an embryo transfer. Right now, it's mostly done in patients that have implantation failure history or miscarriage history. So now we're thinking, for all the information that we have, that in the future, maybe this kind of analysis of the endometrium are going to be done in all patients that are going to do point fertility treatment. So in case you're thinking about doing some more analysis of your endometrium, or you don't know if it's necessary, maybe you can contact us, and also we're here also to answer your questions and everything. Well, thank you for your attention. It was a pleasure to be here, and I will be here answering your questions.